Hello, my name is Tammy Diamond Wells, and I'm a nursing student at UALR. And today I would like to perform a musculoskeletal health assessment on Mr. Isaiah Wells. He has so graciously agreed to participate in this initiative. So, Mr. Wells, as always, if you feel uncomfortable, my hands are too cold, if I don't speak or articulate my words clearly, please stop me and let me know. Um, any questions at this point?
No.
Well, we will begin. Um, right now, I'm going to check your temporal mandibular joint, and I want you just to open your mouth. Just open, close. Very, very good. Next, I'm going to move to your joints in your hands. Um, I'm looking for redness, swelling, any pain. Any pain?
No.
Okay, thank you. Also in the elbow area, joint, this side of the hand. Looking at your metatarsals and your tarsals. Okay. All right. So if you would please extend your hands behind your head. Very good. Also, if you would reach behind your back. Right now, we're looking at the shoulder movement for extension, abduction, adduction, and external rotation. Okay, thank you, Mr. Wells. Next, I want you to tilt your head forward, back, also to the left, to the right, and if you would just turn it from left to right now. Any pain?
No.
Just making sure you have good range of motion in your head area also. Next, we're going to move right along to examine your hips, your knees, your ankles, and also your tarsals to see in your joints and your nail bed to see if there's any redness, swelling as well. So if you would, please lay down. Thank you. You can see very well. So right now we're going to kind of go through the hips and also the knees simultaneously. For the hip area, we're looking for good range of motion, making sure there's no crepitus or any pain with rotating of the hips and also of the knees. We're looking for good abduction, good adduction, and also internal and external rotation. So for the hips, we're going to flex out, okay? We're going to abduct, we're going to adduct with the hip area and rotate. Any pain?
No.
Okay? And we're going to move right along to the knees. We're going to flex, we're going to extend, we're going to bend just a little bit for internal and external rotation. Any pain?
No.
Also want to check the positioning of the knee around the joint area. Any pain?
No pain.
There's no redness, no tenderness, nor swelling noted. We're going to move down to the feet. Looking behind the Achilles tendon, I'm going to do dorsiflexion, which is up, plantar flexion, which is down. And we're going to also look at the tarsals, and we're looking at the joint area to make sure that there's no redness and swelling. Okay, thank you, Mr. Wells. If you would go ahead and sit up, and we're going to take a look at his spine. And what we're looking at, if you would bend down and touch your feet. Thank you. Nice alignment. Any pain? We're going to make sure that he has proper rotation. You can go ahead and stand. In the spine area, we're going to ask him to turn to his left. Just rotate your hips and turn. That's lateral rotation, and just kind of bend, lean to the side. Yeah, to the side. And then lean back. Okay? All the way back. All right. Any pain?
No.
With your spine? Okay, go ahead and stand forward. And we're going to also test for coordination. So if you walk forward, turn, and walk back, we're looking at to make sure there's proper coordination and good gait. Noted. Also, we want to test the strength of his muscles. So if you would sit down, Mr. Wells, please. Okay, hold your hand up and don't let me press against my hand all the way back. Okay? Now if you would do this side and push against. Okay, we're testing the strength. Thank you so much for participating in the Musculoskeletal Health Assessment. Thank you very much.